Welcome to week 39 of the Mama Fed week by week pregnancy update. Will this be my last video with both of us, or will this be just one of the last three?
We'll see.
We will see. But in this video, we're going to discuss what you can expect to be going on with your baby at this point. Maybe they're already born, who knows? What might be going on with you. And then also, I'm going to be sharing how I am feeling at 39 weeks pregnant with baby number 4. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula and currently pregnant with my 4th baby who is due any moment now. Maybe in this video, she will be born. We will see. Probably not.
Spoiler alert. No.
And then the question is, will we have a week 40 and 41 video where I am still pregnant, or will it be Roxanne by herself?
We'll see. Time will tell. I'm Roxanne. I'm a labor and delivery nurse and student midwife and mom of 3. And let's find out what's happening with baby at week 39. So baby is the size of a Cabbage Patch Doll, because I know what those are, but maybe not everybody. So a jackfruit, if you even know what that is, or a pumpkin, which there are various different sizes for pumpkins.
Well,
so
babies can be various sizes,
Which
too.
pumpkin resonates with you more when you go to the pumpkin patches starting soon? Think about the pumpkin you want it to be. Smaller, probably, but pumpkins, week 39. What is happening with baby at week 39, though? So obviously, baby's pretty much fully developed at this point. All of the things are fully developed. Baby is about the size that they most likely will be born if they're not yet born. They don't grow like tremendous amounts after this, but they do grow a little bit more. But at week 39, studies have shown that after week 39, most babies, if they're born after 39 weeks, transition to life outside of the womb very seamlessly and really well compared to babies that are born before 39 weeks. And there's no increased benefit in some of these babies if they progress longer. So like a 41-week baby transitions to life similarly to a 39-week baby based on some research. So this is why a common recommendation by providers started being, well, we should electively induce maybe people at 39 weeks, or they'll start offering like some medical inductions at 39 weeks, such as advanced maternal age is 39 weeks, gestational diabetes is 39 weeks, depending on the severity, and then even some hypertension disorders are at 39 weeks, because again, the benefits of going longer in a pregnancy maybe outweighs the risks associated with those complications. But the elective inductions, this is again, there's no medical reason for an induction other than 39 weeks. So this is called an elective induction based off of the ARRIVE study. They did a study where they electively induced people at 39 weeks versus letting them continue labor. So expectant management, letting them continue to be pregnant until they go into labor on their own. And based off of this study, they found that by electively inducing people, they had a lower risk of C-section compared to letting them go longer. This study has a ton of flaws associated with it, and it was just one study. They haven't really studied this exact situation a ton more after this one study. They just started implementing elective induction across the board. We'll link an article by Evidence-Based Birth all on the ARRIVE study so you can kind of make a decision whether or not maybe an elective induction works for you. But many providers will offer this at 39 weeks. And so you can decide based off of the values and like wants you're wanting for your birth and labor and compare it to which one you would rather go to, expectant management versus an elective induction. Because some people will choose an elective induction and some people would like to stay pregnant for a little bit longer. But this is the time you kind of have to like make that decision with your provider. Some providers will offer a post-dates induction after 40 weeks. And this can be also another subject for debate of whether or not that's beneficial or not. But we'll talk about that next week with or without Gina. Other things that are happening in 39 weeks is fetal movement. Fetal kick counts should still be happening, but you might notice that they're a little bit different feeling. The kick counts may not be as big as they once were. They may not be the same as they once were, but they should still be happening. You should still get the same number of movements. They just may not be the same quality. And if you're not getting like the same number of movements or potentially like decreased movement, reaching out to your provider and being assessed to make sure that baby is still thriving and doing well, because we do want to prevent stillbirth if we can. And the first sign that we can usually get in those babies when they need help is that they decrease movement. Just like when we are sick, we don't move as much. Babies are the same. The last thing that's really happening with baby at week 39 is that their skin cells are like regenerating new skin cells so that they're able to regulate their temperature a little bit better when they're coming out into the world where they have to do that because it's a lot colder out here and it's a lot drier out here. So their skin cells are changing, which is really cool. So that's really it with baby. Their lungs are developed. Their brain's really pretty much developed. They're just kind of waiting until they feel ready to come out, and then they'll start secreting oxytocin of their own and hormones of their own to be like, yep, let's go. And then how are you feeling pregnant at 39 weeks, other than obviously increased vaginal discharge, just like all those previous weeks, continuing Braxton Hicks. Maybe, though, you are starting to notice a little bit more mucus discharge, and that could be because you're dilating and effacing. So your provider may recommend or offer a vaginal exam to see how dilated and effaced your cervix is. If you want to opt into that, you are more than welcome to, but just know dilation and effacement is not a crystal ball. It will not tell you when you are going into labor. You could be 0 centimeters today and have your baby tomorrow. You could be 5 centimeters today and stay pregnant until you're 42 weeks. So choose whichever route you would like to do, whether you would like a cervical exam or not. Just know they are a little bit uncomfortable and they won't really tell you much other than that you are dilated. Another thing that they can tell you with that cervical exam is the dilation and effacement of your cervix, but the station of baby in your pelvis as well. So your baby could be engaged in the pelvis or not engaged. It's also important to know your baby could be like +1 station right now, but that does not mean you're going to go into labor anytime sooner. Unfortunately, engagement is also not an indicator of when baby is going into labor. If we had a crystal ball of knowing, if we had a sign of like, hey, this sign you have, you're going to go into labor soon, we would tell you, I promise. We would not gatekeep that. But there is, unfortunately, no signs with your cervix that will tell you when labor is happening, just kind of what is that snap picture right at this moment.
We get a lot of questions about that as well of my baby's not engaged. What can I do to help my baby get engaged so that my labor can start? Or I'm not dilated at all. What can I do to get dilated so my labor can start? So again, knowing it's just a moment in time. Baby being engaged or not engaged does not equal labor onset. And so we can rather just focus on trying to enjoy the end of our pregnancy, understanding that these things will happen when your baby and your body are ready. And if there are things that you want to do to actively prepare, we can do some movements to help encourage baby to rotate to whatever their best position when labor begins, but we don't have to force baby to engage or force them into any specific position. And we'll link the workout below that you can do during these final days, weeks, or hours to help support your baby's position when labor does begin.
Something that your providers might offer, though, at your appointment, if you do opt in for a cervical exam, is that they can do a membrane sweep. So what is a membrane sweep, though? This is where when they're doing the cervical exam, they're going to take their finger and separate the amniotic sac from the cervix. And this sweep and separation of the amniotic sac from the cervix is going to release hormones in our body, specifically prostaglandins, as well as some other hormones, to help soften the cervix and thin it out, to ripen it up, as well as maybe start some labor contractions. Studies have shown by doing a membrane sweep, this does increase our Bishop score to make our cervix more favorable for labor, which means a Bishop score is a number based off of where the position of the cervix is, the softness of the cervix, how effaced it is, as well as baby's position in the pelvis. So all of these things kind of create this Bishop score of how likely labor is going to happen. And if we can increase this score, this hopefully means that labor maybe will happen a little bit sooner. So studies have shown by doing a membrane sweep, this can either stimulate labor within 24 to 48 hours or cause your Bishop score to increase. But it does not come with no risks. There is a risk, but one, it's painful. It's not the most comfortable thing, especially if you're not already in labor. And two, there is always a risk of infection and that it could cause your amniotic sac to rupture early, leading to needing to be induced because then labor is not starting on its own potentially. So making this choice of is this now the time that I would like to influence my labor starting at 39 weeks, or maybe this is something that I would consider later, is a conversation with your provider on the risks and benefits and using some shared decision making to see if this is the right option for you.
In my experience with my doula clients and my own personal experience with membrane sweeps, I typically find the more pregnant you are, the more likely that it'll be successful. So after 41 weeks. And then I also find that you kind of have to have like some cramping and like some contractions. Something is already kind of starting to happen where it just kind of like kickstarts it for it. For my clients that have like nothing going on, it's usually just like super painful. They have like a bunch of cramping and contractions for a few hours and then it dies off. That has been my experience with membrane sweeps.
Yeah.
But they can be pretty painful depending on how dilated you are as well.
As well as where
so during
that
my
cervix
first
is.
pregnancy, I got a membrane sweep at like 41 weeks and I was like crawling up the table. It was so painful. And then in my last pregnancy, I got a sweep again at 41 weeks because my girls like to come late. And it was like, that's it? Like you did it? But I was much more dilated. My cervix was much softer. And so the sensation that you experience with it can be drastically different as well.
For sure.
The first one did not do anything for me. The second one, I think, maybe like kickstarted things for me. But I ended up just having like a really long early labor with the membrane sweep. So for me personally, I'm a firm believer the more you force it, the harder it ends up being. Too.
Oh, yeah.
And so just trying to be patient with the process can be super beneficial. But also weighing like, well, I might have an induction for a medical reason if I don't go into labor on my own. And so maybe the sweep can help kickstart things so that I can go into spontaneous labor to avoid a medical induction. So there's no like everyone must get this or no one should get this. It is about weighing kind of what's going on. And this is where working with like your provider, if you have a doula, like other professionals that you've chosen to support you for your birth, can be really beneficial to helping you make these decisions. Like you don't have to make them all by yourself.
Exactly. And that's why I think these shared decision-making conversations with your provider, your doula, your birth team can be really helpful to bring what you're wanting from your birth into the conversation, because that's also super important of what interventions will be helpful for you. So membrane sweeping, I personally have only had one, and I had it while I was in early labor. Didn't really hurt, but it definitely did ramp things up a little bit. And I did have a baby like 6 hours later. So maybe.
You never know.
You never know if that was the cause. But other than all of those things happening in the 39th week and just patiently waiting for labor to start, because again, it is a dance between your hormones and baby's hormones to like start labor. No one really knows what combination it is. But how are you doing, Gina?
I am
this dance that is still happening.
I'm currently Googling quizzes that I could take of when will labor happen. I looked last pregnancy, I could not find one. I'm like, surely there's like some quiz out there. Like, what kind of pizza are you? Like, there's got to be a quiz
when will
that's
you
like,
have your baby?
when will you go into labor? I'm still mentally good. Like, I'm mentally all right, mostly because I've told myself that I'm going to go until 41 weeks. And so anything earlier than that will just be a pleasant surprise at this point where I'm like, oh,
Gina's going to have a baby in her arms and still be like, is this labor?
do you think this is it? Do you think this is it, guys? So yeah, I've been Googling quizzes because it's supposed to just like, I'm just so curious on like when she's going to come. And it's like this weird limbo right now where I'm like, okay, well, I can have a baby today or I can have a baby in like 3 weeks from now.
Yeah.
And so there's like this 3-week
Hopefully
limbo
not 3 weeks.
where I'm like, well, when is she going to come? And so you're like kind of pausing things, but not pausing things. But then there's also this window after the baby comes too. So then that extends to like another additional 4 weeks. So I could either be kind of like back to like coaching and filming and working and all that stuff like 4 weeks from now, if I have a baby today, or it could be like 7 weeks, 8 weeks from now. So it's kind of like, well, the back
I would like to
end
know
planning,
as well when I will not be working alone.
Yeah.
anymore.
So that's kind of the limbo that I'm in right now. So what have I been doing to help being in this limbo? I started coloring. So I picked up a hobby.
Not just any coloring though.
They're
like,
very nice. They're like
intricate
boards
coloring.
with like
You
acrylic
didn't just pick
markers.
up like a little My Little Pony coloring
Yeah, they're
book.
pretty nice. Last pregnancy I did crocheting. I got like a crocheting kit and I made a little dinosaur.
But that dinosaur took you a while.
It took me a long time, mostly because it's really hard to crochet with small children. So coloring has been much more manageable with small children because they color with me as well. We've got all of like our little kits and stuff ready for the kids for postpartum. So they have some like independent activities to do, but they've started playing with all of them. Like pieces are all still like contained, But it's not going to be like this like big surprise, like here's all your bins. Because again, it could be today or it could be 3 weeks from now. I'm not going to hold on to a sensory bin for a month. Like,
You should.
so
Gina's just going to keep buying more sensory bins.
I am.
So that
At nighttime, it's just like increasing my like Amazon cart with things.
I think they joke like, oh, breastfeeding is free. No, it's not, because I bought $500 worth of Amazon.
Your Amazon cart lies. Says that it was a lie. I've also been dealing with more like insomnia again, where I just at night I just am not tired and I just want to stay up. But my kids also want to stay up too, and so it ends up just being like us like playing at night until like midnight or 1 a.m. and then they like one by one start passing out, and then I'm like, all right, well I guess I should go to bed and lay down. I haven't really found anything that's like triggering me to like feel like I need to stay up. I think I'm just like waiting. Maybe I'm just like any day now, any moment. Now, maybe in this video. So that's been fun. Being a little bit tired all the time. Still moving my body and exercising. I'm still doing our prenatal program. At this point, the workouts are starting to taper a lot more. So I'm definitely not lifting as much weight as I was like 3 weeks ago or earlier in the third trimester. It's definitely a lot more body weight and mobility movements. A lot more free weights with like dumbbells and bands and stuff instead of with the barbell, and just making sure that I'm moving well, still doing all my pellet forward prep and release exercises, trying to keep myself super comfortable. I'm surprisingly feeling like really good physically within my body at this point, other than at night. I definitely have like way more Braxton Hicks, and like when she moves, it's like a little alien like rolling around in my belly. But yeah, any moment now. So yeah, I found a new hobby. I am entertaining my children at 1 a.m. because they all have insomnia with me. And, just kind of waiting in this limbo for whenever this baby comes. And so if you've picked up a hobby, let me know what you did, because I want to add, I would be 41 weeks. I'm going to run out of
a lot of
coloring
time
boards
to pick up some new hobbies.
So thank you so much for listening to week 39 of what to expect during your pregnancy. Baby is pretty much done. They're just waiting at this point. Everyone's just waiting at this point. You are probably feeling, maybe you feel great, maybe you don't feel great. I guess it's kind of like hit or miss at this point with most folks on like what side of the spectrum that they're at. There might be some different options being presented to you by your provider, such as an elective induction. Maybe there's some complications starting to develop at this point, and we're looking at a medical induction. And so there's different avenues that you can take with that. If you are looking at an induction, either for a medical reason or for elective, we do have a standalone course that is all about induction. So understanding what your options are as you navigate it, kind of what to expect during it, because inductions can be really scary. Like maybe you had a really different birth plan for yourself. And so when we can understand what our options are and how to utilize those different tools for our birth, it can make it so much less scary, which is something that I wish I had during my first birth, where I was pending an induction. It would have definitely decreased my anxiety pretty significantly if I understood what the different options were that I had. If you're looking for more support during your pregnancy or postpartum, we do have our condensed course. We're kind of at the end here, but if you're still pregnant, there's still time to take anything. The condensed course goes all about labor positions, how to push, different comfort techniques, things for your partner to do during birth. And so that's just kind of like a deep dive into just labor so that you have the tools to navigate your birth if you suddenly realize that maybe we should do some preparation for birth. Our fitness programs will probably be on that at this point. We have some free mobility exercises on the YouTube channel that you can join. But for postpartum, we do have our postpartum prep course so that you understand what goes on after you give birth, because there's a lot that goes on after you give birth. What would be going on with your baby, in addition to infant massage, infant CPR, and then you can bundle that with our postpartum fitness program so that you can return to fitness after birth. And as a thank you for listening to this entire video, you can use code YouTube10 to get 10% off any of our online offerings, both for pregnancy, for the postpartum. We have professional courses. And so, yeah, maybe we'll see you next week. Maybe we won't. Maybe you'll have your baby before me. If you're due after me, it would only be fair if you waited until I gave birth, though.
Yeah.
Because I was here first. Here first.
But if you have hobbies that you've collected or started during this end of week or end of pregnancy, please let us know in the comments below for Gina to try out if she is still pregnant, which she most likely will be.
I will probably be. So we'll see you next week.